My name is Deliz, and I'm the Senior Assistant Director of Graduate and International Admissions. We'd like to thank you all for taking the time out of your busy schedules to join us and our wonderful graduate program faculty and their guests for today's Hot Topic webinar, Equity in Healthcare. First, I'll tell you a little bit about the purpose of today's event, introduce our fabulous guests, and then I'll hand things off to Dr. Sophia Jones to help facilitate this valuable discussion. Um, Tonight's webinar invites prospective graduate students to engage in discourse with faculty and industry professionals about trending topics in the field. The event gives you the opportunity to learn more about our graduate education, career opportunities, and challenges in the healthcare field. I invite you to take part in the conversation by answering the polls like the ones that you just answered. Um, Writing in the chat throughout the event and submitting questions using the Q&A function at the bottom of your screen. Also, by sticking around at the end to see those questions answered during our Q&A session and to learn a little bit more about our MS in Health Science program. Now let's get right into it. So our first panelist, Dr. Sophia Jones, is a training and consultation specialist with Rutgers Behavioral Health, Behavioral Research and Training Institute for the Children's System of Care Training and Technical Assistance Program. She has over 18 years of experience in the behavioral health field, specializing in culturally competent focused crisis intervention and service plans. In addition to her role as a training and consultation specialist, she teaches as an adjunct instructor within the undergraduate and graduate programs at Rutgers University and here at St. Peter's University. So welcome, Dr. Jones. Um, Dr. I think, has Dr. Cologne joined us or no? No, I don't think so.
Yes.
So I'll just introduce Dr. Merlino, who has been a leader in the field of innovative, ethical, and community behavioral healthcare for the past several decades. He received his medical degree from New York Medical College and Master of Public Administration from Baruch College. Among a long list of accomplishments, Dr. Merlino is a professor at SUNY Downstate College of Medicine and a visiting professor of psychology and religion at Union Theological Seminary in New York City. So, welcome, Dr. Merlino. Thank you for joining us. Dr. Jones will now share a presentation with us that will lead right into our discussion. So, Dr. Jones, take it away.
Absolutely. Thank you so much. I just want to, again, thank you all for having me here today. It's a pleasure to be in great company from St. Peter's University. We're just going to begin today by, again, just offering you the opportunity to embrace this journey and to talk a little bit about some important hot topics. And we went through this presentation and thought about what are the hot topics, and there's so many to discuss. So we're just going to give you a taste of what it would be like if you join us in this conversation. And I mean this wholeheartedly because we embrace the idea of having conversation around these topics, not as an issue as well, an issue, excuse me, but also as part of your journey, and also to think about it in terms of what is the next step and how you can be involved in promoting action on some of these topics that we discuss. So first and foremost, I'd like to begin by giving you a little bit of a question. And if some of you are not familiar with Menti, you can just take your camera phone and you can scan it over the QR code. I am also going to provide the code in the chat box for you. I'm going to stop my screen again, and I'm going to move over into Menti so that we can get some feedback on your question here, which is, what does health equity look, sound, and feel like to you? And we have a few responses already. Insurance for all. So that's one thing that is important. So take your time. You can go to the link. The code is right above you, or you can go into menti.com, which I provided the link in the chat box. Once you get to menti.com, you can enter the code, and we would love to see some of your feedback. Your second option is to go back to that QR code, which I put up for you. Scan it with your phone, and you should be able to participate. So I would love to see some participation on what does it actually look like? What does it sound like? What does it feel like to you, right? And keep in mind that Mentee is anonymous. So the great thing is that we are able to share in this format, but it's not really attached to your name. And so I say that because I want you to feel free with expressing your opinions about this topic. And hopefully we have created a safe enough environment that you can express yourself on the screen and just tell us a little bit about how you feel about this, right? So inclusion and representation for all, okay? Insurance for all. And I'm loving, and Joe is my partner tonight. Joe, if you could just tell me, what does it kind of look like for you so our participants can kind of chime in on our discussion, right? Because, oh my gosh, here it comes. Accessible resources, right?
I think I'm having providers that look like me or look like you or come from my neighborhood, come from my background.
Absolutely, right? Inclusion and representation for all. What do you look like when I come to visit in the doctor's office to receive services, right? Availability to necessary resources such as education, quality supermarkets, absolutely. So they're delving into an area that we're both passionate about when we think about quality supermarkets and in marginalized communities and food insecurities, right? So somebody out there is on the same page that we are when we talk about these issues, right? So we wanted to give you the opportunity to just get an idea about what health equity looks like, right? And when we talk about sounds like, that means we're talking about communities and what's it within communities. What does it sound like to you? It sounds like people who are prospering, who are growing, right? And what does it feel like? It feels like I can go to a grocery store and I can get those things that I need that I know are going to nourish not only my mind, but also my body, right? And so I want to stop for a minute. Oop, and here we go, eliminating food deserts, right? So that's a good one too. So I am loving the fact that you are already in that mindset of what are some of the things that look like when we talk about equity. And that's an important piece of the conversation. And we're going to continue in this direction, right? So what I like to do now is I'm going to stop sharing and I'm going to come back in and back to our presentation. And this is so interesting because we have some people in our audience that are really chiming in on that question about equality and equity, right? And so we've had discussions surrounding this for many, many years. And it really focuses on what does equality look like and what does equity look like? And if you see here on the definition, it says, what does equality look like? Well, that looks like a distribution of the same resources. And if you read back through this, it says these are opportunities for all the individuals that you just talked about who need the services. Because when you put in the Mentee, you said all, right? And then when we talk about equity, that's customized. So that means that some people may need a little bit more than others. And that's okay because we want to make sure that they reach their maximum potential. In order to do that, we need to make sure that we have equity. And so this is one of the reasons why often you will hear this terminology and these ideas about equality. And these ideas about equality came when we started to talk about equity and inclusion decades ago, right? Decades ago when there was this red light to say what is happening in communities where they don't have access. Well, let's talk about equality. But now we start to see these individuals as having unique needs. So now we need to talk about equity. So that shift in paradigm is so important. And whoever's out there, hello to you, because you chimed in on it right away, because you're saying we want this for all. And guess what? We need it to be equal. So when we talk about health disparities, and we think about this whole idea of a link, right, to socioeconomic status, right, and these environmental disadvantages. We have to think about what are actually surrounding individuals and not giving them the opportunity to prosper. And just like we said in the previous slide, to maximize or reach your full potential. And so when we talk about health disparities, this can be based on race, ethnicity, religion, socioeconomic status. Am I able to provide for my family? Am I close enough to other jobs that's going to give me the means to provide for my family? What does my housing look like? Well, I'm getting a little bit older. Let's talk about age and gender. And pause right here when we talk about mental health, because that is something that we've been discussing for many years. And now it's got a bigger stage more than ever. When we think about even mental health at how it relates to health disparities, this is now when we have that combination of not only thinking about the body and health and equity, but we're also thinking about mentally. Because I always say if you're not upstairs ready, right, to and willing to move and grow as an individual, how does that affect your physical well-being? So it's all intertwined. Cognitive, sensory, or physical disability, right? So persons with disabilities, this kind of hones in on that idea of access, which you touched upon in the first question. What about access to services and access for all? Okay. Sexual orientation or gender identity. This is where we talk about the health disparities that are related to individuals who identify as being part of the LGBTQ community. This cannot be something that is dismissed in this conversation, right? Where do you live? What's your zip code, right? That plays a huge part in whether or not you're going to be or suffering from a health disparity. And we talk about geographic locations, and we think about New Jersey and all, and how it is extremely densely populated. Other characteristics which we cannot dismiss is going back to history. And historically, all of these things that we've talked about have been unfortunately linked to certain communities, communities that have been suffering from poverty and food insecurities for years. So we can't dismiss the fact that when you start to begin this conversation about inclusion and exclusion and discrimination, and how we want to move to this conversation of inclusion, because health disparities has often affected this population. When we think about the social determinants of health, and this is something that many of us have been familiar with for years, and this is something that we're often seeing on the news, I sat back and said to myself, I don't remember a time when you would watch television and you would see someone talk about mental health and the need for resources and social determinants of health and food insecurities. And these are some of the things that we need to address. But first and foremost, we need to talk about what is around the individuals that we serve, right? And so, Joe, in talking about this, right, I'm just sitting back looking at this diagram, and things are popping out at me. So what are some of your thoughts about this one in terms of social determinants of health?
Well, I think you hit it right on the head. I mean, where are we living, and what's that environment like? So if you're growing up in a poor neighborhood, as I did, and by the way, the one thing that was left out of my bio was that I'm a graduate of St. Peter's College, now St. Peter's University. So I go back a few years before the university was a university. Um, but St. Peter's gave me the lift to be able to come from growing up in a project, not being able to afford college, to providing financial aid, and then providing the educators to open my world to a world I didn't know about because of where I came from, to allow me to then go on to medical school. So in that neighborhood, are you exposed to air pollution? Are you exposed to toxic waste in the water system? Is lead paint a problem? These are the kinds of conditions that are going to affect your physical and your mental health. If you don't have access to healthcare because you can't afford healthcare, you're not going to have the same advantages as someone else with insurance. If you don't have a clinic or a hospital or a healthcare provider in your neighborhood or in your community that looks like you and can talk to you and relate to you, you're not going to wind up having that kind of access to healthcare. So all of these kinds of things, if you don't have education about the harms that can come from smoking or obesity, you're not going to be aware of the risks that that puts you at in terms of hypertension or diabetes or heart disease or cancer. So all of these things are social determinants of health that impact what happens to us as we grow up and as we age. One of the things I know, Sophia, we're going to get to talk about perhaps is the ACEs, the adverse childhood events studies that showed what happens to us before we're 18 years of age tremendously impacts our mental and physical health when we become older adults. whether it's cancer, whether we're going to be subject to drug abuse, whether we're going to become smokers, whether we're going to have mental illness. All of that is influenced by what happens in our first 18 years of life. And we can impact that despite what adversities children have growing up by being informed healthcare providers and others with health science backgrounds so that we can really implement changes in the healthcare system to help those individuals.
Oh my gosh, Joe, like you really are knocking this out of the ballpark, right? Like I'm just sitting here nodding my head like you have definitely put some key thoughts in my mind about this because one thing that is for sure, when we talk about social determinants of health, we talk about individuals who are grown up in communities. And this is such an important part when you talked about the ACEs study. And if those of you who are not familiar with the ACEs study, this is something that we go into depth in many of our course material because it's important because it kind of signifies how that person, that individual as an adult is going to be able to adjust to their environment, to have access to all the things that we just talked about, right? And just having a one score, um, one check
Cool.
next to one
Yeah.
of those determinants. Thanks, Joe. Will actually impact your life, right? And this is how excited I am because having this conversation and linking all of these things to healthcare and health equity is so important because we're seeing this from such an important lens, right? And so we're talking about our experiences as personal as it can be, as professional as this can be, to give you an idea of how important this is and how you can come and collaborate with educators within our programs to allow you to have these much needed conversations. So when we talk about relationships, right, because this is important as well. If you think about you as an individual and the different people that you have involved in healthcare relationships, healthcare team, patients, people within your community, resources in healthcare services don't always come from one place. And so how do we also talk to our individuals and communities about smaller clinics or longer hours or things that people in the community really need, right? For working adults, right? Or someone who needs to go out and work early. What are the hours like? How do we have access? And when I talk about the healthcare relationships, it's going to be and should be unique to different communities and the needs of those families. In terms of my experience, when I think about the children's system of care and providing mental health services, there was a very, very interesting thought that came up with parents and saying that I don't have the transportation to receive those services. I would love to receive mental health services, but at the same time, I don't have access. And so what did the state decide to do? They decided to come into individuals' home and provide a free service. So who are you as a team to make sure that all of your team members are educated on all of the services? Do you actually know your patients, right? Do you know that your patients come from a diverse population, how to service them? And then looking at the community, what type of resources are involved? And that's an important piece of this conversation as well. This is one of the key points here that we talked about, right? And Joe mentioned a few things, your neighborhood, your environment, right? The ACEs in healthcare, right? And let's sit back and kind of look at this because first of all, it's a beautiful diagram, right? I love the colors, right? But it also speaks to just what you were saying, Joe. Born, grow, live, work, and age,
Yeah.
right? Did you want to add any key points here? Because I see a lot of things that are interesting to me.
Well, housing, for example, one of the major problems we know we have in this country is a lack of adequate housing. Look at the homeless population. And who are the homeless? The homeless are disproportionately people of color, uh, people with mental illness, people with substance abuse issues. Who are the people that are in the jails? It's that same group. So something's not right, right? And this is again where when we talk about inequities, where it really is going to take a motivated and informed healthcare community and providers that have health sciences background and awareness to really make the kind of changes in order to impact the changes that are necessary.
Absolutely. And one thing, just looking at this figure that we've provided to you, right, by the California Department of Health, it really speaks to how you have to build a very solid foundation, right? Health and society, health and environment, health and community, and healthy people, right? And this is what we actually want. So when we think about these simple terms that we've given you, these simple ideas, we can hone into on prevention. Because if we're having dialogue about prevention, this again helps the community. Why do I want to deal with diabetes and mental health when it's here and now? Why aren't I talking about these things and these services ahead of time, right? Educating families on the importance of screening, right? Making sure that they have access to WIC or SNAP programs or avoiding additional food insecurities, letting people know about other services in the community. So I want to thank you all for coming today. Again, we're going to stop for a few minutes and I'm going to stop sharing so that we can discuss a little bit further some of these important key points and also address any questions. We're going to continue to have this rich dialogue about some of the things that are so important in terms of and you'll notice that Joe and I keep saying about our community and about society as a whole. Because when you take on these positions, you think, okay, I'm only going to service one county, or I'm only going to work with a few families. And in actuality, that relationship expands so far beyond your town and it expands into other communities. So the reason why I give you this example is because often people think, well, I live in a nice neighborhood or what you consider nice, or I live in a county where we don't have these things occurring. Well, guess what? If you can drive, and you know how New Jersey is, if you can drive a block or two and you see that there are people who are suffering, then it should be concerning for you. So I want to take a moment now and I want to answer any questions, absolutely, with my partner in crime here for the night, Joe, and talk a little bit about these important topics. So do you have any questions for us, Deliz?
So first, I'd actually, let's see here. Spotlight for everyone. Okay, so if you'd like, we can dive into our discussion questions or we can answer the question that just popped into the chat.
Okay. So
So
let's go with the one in the chat. Chat trumps all.
Avery Tan posed a question. So, who makes the decisions that affect a healthcare organization in your local community? Who's missing from the table? How many community members gain access to power? If you had the power, how would you change the process? What decisions would you make differently? What additional resources would you need? What are the priorities for action?
Okay, so first of all, thank you, Avery. I'm going to address these questions separately. And of course, we're going to kind of give you some food for thought as well. And we'll go through your questions because we want to be mindful that you took the time and asked, and we'll go through them separately because it's not just one big answer. It's not one little answer either, right? So who makes the decisions that affect the healthcare organization in your local community? And so when you ask about this in a broad sense, when we talk about different communities and different service providers, it will vary. Okay, so I have to give you an example based on one particular county and the county in which I worked in, which was Middlesex County. And the decisions are often come from the local level, the state level, and the federal level. But at the same time, when we think about locally, often you may have connections with hospitals or agencies within your catchment area. And so that may be Trinitas in some counties. For Middlesex County, it was UMD&J, which may be Rutgers. It may be JFK. It may be Robert Wood. So these are the organizations that will collaborate with nonprofit and for-profit organizations to connect with communities and to talk to community leaders, which need to be definitely have a seat at the table, which is one of your other questions, to make sure that they are meeting the needs of that community. So what does that kind of feel like, especially for me in my wheelhouse is in mental health? It means that you have to talk to families, you have to talk to individuals in the communities. If that means going to the community centers or going to the schools and collaborating with schools as well, then these are the things that we would do. Nothing like setting up a great program and in actuality, you can't receive the funding or it's not needed within a community. So who is missing from the table? Often it's the people who need the services, and the people who need the services should always have a voice. One thing that we talk about in terms of the children's system of care is that we need to have the family involved in the entire process, and that means the family and the community. And if we set those services are centered around the family, then they have a voice and they also have a choice. So I'm going to pass the next question over to Joe because I'd love to hear your insight on this. How can community members gain access to power?
Well, you've got to get off the couch, you've got to register to vote, and you've got to make sure that people that have your interests at heart and are aware of what your needs are elected to power. I mean, going back to earlier questions about who's making a lot of these decisions, many times it's elected officials because much of what happens in healthcare is related to what becomes law. And what becomes law is what politicians pass as laws. And who hires the politicians? You do. So you can't have a say unless you're registered to vote and you actually show up and vote. The other thing that I think is really critical is community involvement and community participation. Many health organizations, including hospitals and clinics, et cetera, have community advisory boards. And this is something that you can participate in and have a voice and have a seat at that table. So for us to have the kind of healthcare that we want and the resources that we need requires advocacy. And that means you having a voice. So you have to sort of empower yourself to take the power that you're entitled to and utilize that power to make sure that we get the resources that we need and you get the health care that you deserve.
Absolutely, right. And so when we talk about this, it's actually thinking about a shift in the power dynamics, right? To make sure that the people in the community are involved in the process and to make sure that they have a voice. So if you had the power, how would you change the process? That's an interesting question. When we think about having the power, I sometimes, as a former care manager, I often thought of having this magic wand, right? And to be able to cure and address most, if not all, the concerns within communities. And I think if I had the power, I would definitely increase the resources that many of the individuals who are passionate about this work have at their disposal, and that it is long term. Often you would connect with a family and only be able to provide short term services, so that it will be long term. It will be empowering as well. What decisions would you make differently? Joe, did you want to take that one?
Ugh, what decision? There's
Notice
so
how I threw that one to you because I'm like, ooh, I got so many. They don't have time.
many. Why don't you start us off if you've got a lot? I don't want to. What decisions would we make differently? You know, I come from the medical field, and it's not popular, but I think the way we do health insurance in this country, is something that I think needs to be changed. And I'm more of an advocate for a more universal type of healthcare, and to make sure that there's truly a safety net. I think we're moving in that direction, and I hope that that really does continue. I think the system that we have in terms of malpractice and other kinds of litigation things often drives up the kinds of costs that become astronomical, that can really be lowered so that there be more resources to provide healthcare instead of having to defend ourselves in courts of law. I mean, when we look at the world in terms of other educated countries, we don't do very proudly in terms of how we are, in terms of what our health is in this country and how our healthcare is delivered. So, and in terms of what our longevity and lifespan is. We don't compare favorably with our countries in Europe, for example. So there's much that has to be improved, but it really does take a concerted effort on the part of the healthcare community, the political environment, and our communities, our social communities.
It's such an interesting point that you made, right? Because when we talk about the next question, it really discusses resources. And that's one of the key things that is often needed. But who is actually going to provide those resources has always been concerning. Who is going to fund those resources? So I guess if I had my magic wand, I would make sure that, of course, housing is addressed. I will also make sure that communities have access to food and healthy foods. There's been so many families that I've worked with throughout the state of New Jersey, and their main concern has been, where's my next meal going to come? And when we think about food insecurities, it's not that they don't have food, it's that they don't have food consistently. And when you don't have food consistently, how this can affect your mental health. And so I think when we talk about those additional resources, we really need to go to and think about what are the fundamental needs that we all have every day. And if we can address those needs, these are part of the building blocks for where we can become healthy individuals and have healthy communities. So what are the priorities for action? I think that Joe and I have touched upon so many key points, but when we think about the priorities for action, we have to realize that there was often this discussion that we have to separate or think of healthcare and separate from politics, right? And so we have to think about collaborating at all levels and to make sure, like Joe said, to be registered to vote so that you can ensure that your voice is heard.
And I would just add to that too, a real emphasis on improving education. Um, you know, education is one of those resources that we take for granted in our country, but we really need to do a much, much better job from preschool on up, high school, college, et cetera, to do much better in terms of educating our citizens, quite frankly, because it's shown over and over again in studies that, you know, the more educated individuals are, the healthier they are, the longer their lifespan is, et cetera. So I think that one of the things when we talk about resources that have to be provided is more in the way of education.
Absolutely. And such an important point because we know that our life expectancy increases depending on your level of education. And when we talk about this whole relationship when it comes to education and your life expectancy and access to resources and access to health insurance, this ties into many of the topics that were not only put into Menti, but in the chat box and also the dialogue that we have often, right? So thinking about education in terms of life expectancy, this also will kind of be a trickle down effect, right? If you don't have a degree, then you're not able to obtain insurance in most cases, because we know since I believe it was 1950, 60, cue me in on that, Joe, where many companies would offer insurance as an incentive to work there, absent of the higher salaries. So even if you have a general discussion with someone, they say, I like my job, I love my job, I have a great career, but I have great insurance. And that's a drawing point, and was and still is a drawing point for many individuals because they want insurance. And so when we talk about the Affordable Care Act and we talk about this idea of insurance for all, which many people are a proponent of, or some people push back from it, think about the whole idea of having insurance and the whole idea of having an education to obtain a job that will afford you the opportunity to have insurance. That means that now you can have annual screenings. That means that you're more focused on preventative care, right? This means that you also have the days off to go and to get those screenings, because nothing like having the ability to have that service through your insurance, but then you don't have the flexibility to do that. So when we start to talk about insurance and we start to talk about plans and we start talking about politics, this is where we go underneath that umbrella of healthcare policy. And so we cannot skirt away from, and I tell people all the time, we're not going to talk about politicians, but we could, right? But we're going to shift that dialogue to talking about how do we look at health equity, health inequities, and thinking about policies, right? And how do we change policies, which is what Joe was referring to when we talk about having the right to vote, voting, because showing up to tell the people in our district, in our communities, that these are the things that we want. So here it is, that loaded dialogue about the need for change. And we have a few minutes here. And before we continue on with the other questions, I want to see how we feel about, and I'm just kind of throwing this out, how we feel about other concerns in communities. Is there anyone here who wants to address other concerns in communities? Because we talked about food insecurities, right? We talk about social determinants of health. Was there anything that we said that kind of came home for you, or kind of said, that's something to think about? And what else do you want to add to our list of important key discussion points here?
So we have a question in the Q&A, but right after we answer this question, I want to dive into some of our panelist questions because
Okay, great.
so we don't run out of time. So our one of our attendees asked, how do we go about making changes in schools when it comes to things such as more nutritious meals or health education? So I think that to your question about issues that they're concerned about, I think nutritious meals and health educations is one of our.
Mhm.
That's so critical. I mean, from taking sugary drinks out of vending machines and snack foods that aren't healthy is certainly a start. And I know a number of schools have been doing that. At the medical school where I teach, they've really emphasized in the cafeteria providing healthy meals. The fact that so many food labels now have nutritional information on the label so that you can be aware of what it is that you're consuming. And here again, it goes to education. You have to understand, what does that mean? If I eat this many calories, I'm going to gain weight. What does gaining weight mean in terms of obesity and health? So this is where education comes in. I don't know about you, but I used to go to Starbucks and I would, pick whatever I'd like and I would really enjoy it. Once they put the labels on, I have black coffee. That's what I have when I go in and when I come out.
Mhm.
Um, who knew 5,000 calories for a beverage? So this is an important issue. So yes, food and in the schools and in the educational system is really critical.
Joe, you bring up an important issue, because if you don't believe that schools are part of this conversation when we talk about health and when we talk about overall health, starting with, the COVID-19, one of the first concerns was whether or not some of the children in communities were going to have access to those meals that they get from the school systems.
Right.
And so we saw that when there was a lack of access to those meals, how that was so critical for families and how they were missing those nutritious meals throughout the day, and how many meals that are actually provided by the schools.
Right.
And so when we talk about this idea of nutrition and development, this goes back to the question of collaboration and how important it is to talk to schools about what are they actually providing for children, right? And you talked about labels. And when we think about meal plans,
Mhm.
we kind of put the meal plans also in the conversation of service plans. Because if we're working with someone who is concerned about their mental health, but the top of their list is the fact that they don't have access to nutritious foods, or their child doesn't have access to those foods, this can be concerning for any family.
And
And
you know
what does
when,
that sometimes lead to? Stress,
yeah,
right? And so this is that conversation that we have, that one thing leads to another thing. So that's a good question.
yeah. What I was going to jump in and say, all of our students have access to smartphones now, right? And one of the 5,000 diets I was on Weight Watchers, they had this app where you could just screen the image on a package, and you would know exactly what you're taking in terms of fat, in terms of calories, all of this stuff. So again, educating our students so
Mhm.
that they know what it is they're eating, and let them use their smartphones to really find out what's in that bag that I'm buying.
So, a lot of us that have come from what I used to say is boots on the ground, right? And Joe and I shared experience where we were in the field, we were in communities, we were in people's homes providing services. And one thing that I was proud of was the fact that I would sit down with families and not only talk about the food that they were purchasing, but how do you look at a recipe and cook those meals and expand those meals for longer periods of time, right? Because we think sometimes this simple act of having this discussion about food, we also have to educate on preparation of food to make sure that it lasts throughout the week, to make sure that they're making healthy food options or purchase options when they go into the store. And so these are the things that are so important as role as health educators, but also, being able to hone in on some of the skills that we have personally to help families, right? And this is something that has been and remains very passionate of mine to talk about and have open discussions about poverty, to have open discussions about food insecurities, to talk about the simple things that will help families. And that includes having serious conversations about what should be purchased when you go to the grocery store, or what is your priority in terms of your health for that week. Choosing leafy green vegetables, right? And these are the things that are so important. But what is key is if you don't have access to the grocery stores. And that is one of the things that someone had asked earlier about access as well. So I'm a huge proponent of collaboration and a huge proponent of access, because it's great to say that this salad is healthy, but if that person can't access it, then that becomes an obstacle for them or challenging, right?
Alrighty. So, this has been so interesting. um, I
We
I
try to
can
spice it up for you.
Yeah, it's been a great discussion, sort of led by audience questions, which is great. So, I'll trim down our questions since we only have like 12 minutes left.
Okay.
I'm just going to ask maybe the two questions that sort of that might transition out, you know. So we'll bounce off of education and health. So, what are some of the ways educational opportunities affect health?
That's a loaded.
I know,
So
because
many.
we were talking about the social determinants of health, and education was one
Mhm.
of those things. Um,
Well,
so
let's take it. I'll take it from this perspective, and Joe, you come in because
So,
this is a fun one for us, right? Let's think about health literacy, right? Because sometimes we on that list when we talked about being culturally competent, is linguistically competent too. So as healthcare providers, we need to make sure that we are giving out information that the individual can read and comprehend, right? But we also need to be mindful that the average reading level is at the fifth grade.
mhm.
And so, how do we address education? Absolutely. We need to educate the families that we're working with, the individuals, the adults, whatever population you choose, on the importance of sitting down, having this dialogue about what does that prescription actually say, right? But before we even have that conversation, do we have information within our organizations or virtually that provides the information in languages that they understand? We live in such a diverse society. If you're giving out information only in English in your community, then are you really servicing everyone in that community? So we have to talk about not just education of individuals and their communities, but also we have to touch upon health literacy. And health literacy is very important as healthcare providers.
You mentioned diversity, and I think that that's really a really important point, because one of the things that education offers is it takes the person out of the bubble that they sort of exist in and exposes them to a variety of views, a variety of people, variety of ideas, even concretely in the cafeteria, perhaps a different way of eating or a different food. Who knew I liked lima beans, you know? So, um,
I do too.
but, if you didn't have it at home, you might be exposed to it when you're at school and in your education, and you might see that some of the misinformation you might have gotten, whether it's from television or from even family, as well intentioned as it can be, could be countered by other views. So I think that that's another important role of education.
Absolutely. So it's sometimes it's such a simple conversation about the colors on your plate. Like there should be color on your plate. There should be green, there should be yellow, there should be squash, there should be zucchini, there should be colors on your plate, right? Just starting from that basic point, right? What an interesting point, Joe. I love the Starbucks.
Yeah.
So true.
And I
I,
drink black coffee too, so I can totally relate.
Just next time you're at Starbucks, take a look at any of those labels.
Oh man.
so I'd like to use that as an opportunity to jump into just one last question, and then we're going to go into talking about our program and go into some Q&A because we don't want to keep anybody past the time they've committed to us. And again, we appreciate you guys for joining us for this discussion. So I think this is a good question to end with. It may be loaded, but we'll keep it
Oh, we
short.
love loaded.
um, so, do you feel that there's a lack of political will to address inequities, and why or why not?
Mm.
Mm.
Again, the people that make decisions are the people that are elected to office.
Mhm.
And if you're not having a say in that process, you really can't complain about the results. So I think,
Mm.
again, it goes to activism, both in terms of you as consumers and you as future, hopefully, healthcare providers.
Absolutely. I can't agree with you more, right? People, there's a lot of discussion about what the federal government should do. And I understand that. You should exercise your right to vote. But I also believe that there is a responsibility of the individuals at a state level, at a local level, that you have to address as well. And so I see this, we've always had this discussion about how there's a relationship between healthcare and policy. Now, because of COVID-19, we see that when you have a public health crisis, you really can't skirt around that. And so when we think about this whole idea of change, it's going to come from us making decisions about who we send to represent us as people, as a community, as individuals. And that is what's going to make the difference.
I'm so glad you touched on COVID because we didn't talk too much about COVID. And we're living through an experiment right now that probably has never happened again in any of our lifetimes. Hasn't happened in mine, so most likely hasn't happened in yours, right? And look at some of the things that has come out of COVID. One is it's changed education, right? So much of us are teaching now via Zoom, seeing your doctor via Zoom. So it's going to increase access to healthcare providers. It has, and hopefully that will continue. Look at some of the negative things that have come out of it, the impact on our lifespan, right? So the lifespan across everyone in this country has been reduced as a result of COVID. But in terms of Blacks and Hispanics, 4 times, 3 to 4 times the reduction in lifespan for those communities versus the white community. So that touches right away on health inequities, right? And we can go on and talking about COVID, the role of vaccinations. So there's so much here that impacts how healthcare is delivered, which really, again, touches on fields of study, for example, like health sciences.
And it's so important that you mentioned technology too, because we're available now via Zoom or WebEx or Microsoft Teams, whatever service you use, it allows you to touch people in so many different areas, right? So now, as opposed to living in a rural area where you don't have access, which that's an entirely much longer webinar about healthcare in rural areas. Well, now you could actually see a doctor, and maybe you could meet with a psychiatrist, which you can't meet with on a weekly basis if you don't have transportation to that office or that clinician is not able to visit these areas. So this conversation has expanded, and access to much needed healthcare services has expanded and are coming into individuals' home in such a unique way because of the pandemic. When you sit back and think about COVID-19, yes, I believe there has been some negative things that have come out of the pandemic. But I also believe that there have been some changes that are going to be beneficial to many individuals moving forward. What those changes are going to be, many, many generations away, just like you said, Joe. Like we won't, we hopefully will be able to see that, but we know that has begun. And because we've had multiple pandemics, especially over the 2020, things in terms of healthcare is going to change. The dialogue surrounding healthcare, diversity, equity, and inclusion, right, is going to forever change. And that to me is a good thing.
Absolutely. Yep.
What an enlightening conversation. I'm so glad that our program faculty, primarily our program director, Dr. Mortellaro, invited such engaging guests to have these relevant conversations. Thank you all so much for your perspectives. Like I said before, I'm briefly going to just share my screen, and we'll go through this presentation fairly quickly so we can have some time at the end for your questions, because we want to make sure that we address all of your questions. So I'll be quick. I hope everyone can see my screen.
Yes, it looks good.
Perfect, thank you. Um, so let's dive right in. So it's a quick agenda. Why St. Peter's University, admission requirements, graduate program information, and then some frequently asked questions before we go over the questions that you all might have. So we have the Jesuit values, and the commitment to each individual student, their needs, their schedules needs. Many of our students are working professionals. We don't want students to sacrifice or have to choose career or studies. You can do both. So we have flexible evening schedules. This particular program is actually available fully online. So this information about our conveniently located campus is not necessarily necessary, but the good thing is that, as you can see, we have faculty on campus, so they're easily accessible and easily reachable, just as if you were in an in-person program. Um, Among our admission requirements into our program is a official graduate application, which you'll receive the link to. It should be coming up in the chat if it hasn't already, but it'll also be in your email. Your official transcript should certify your bachelor's degree conferral with a minimum 3.0 GPA. So you can send us an unofficial transcript if you'd like, for a provisional decision, but we will need the official transcripts eventually. In addition to that, you'll need 2 letters of recommendation, a personal statement, and a resume. So here is the program details. As I mentioned before, the program is fully online. It is the MS in Health Sciences, and it's a 36 credit program that is at the very competitive rate of $695 per credit. So it's very affordable, very flexible, and accessible to our working students. Uh, so frequently asked questions. Students often ask how long it typically takes to receive a decision. It can take anywhere from 1 to 2 weeks. However, you can receive a decision sooner, but we do like to ask students to wait up to 2 weeks from the date that we receive all of your application materials, all of your required materials. We do not require the GRE or the GMAT scores. There is no fee associated with the graduate application. And while there are no institutional scholarships or grants available at the graduate level at St. Peter's University, we do encourage students to apply for their FAFSA and see what their eligibility is for any federal or private loans. And our financial aid um, department would be happy to provide any trusted lenders to students who are not eligible for federal loans. When is the application deadline? So there is no application deadline. We're on a rolling admissions basis, which only adds to the flexibility of St. Peter's University. So really, we accept applications all the way up until the start of the term. We do, however, encourage students to get all of their materials in at least 2 weeks prior to their desired entry term. Now we will open the floor to some questions and then conclude. So if anybody has any other questions, please feel free to put them in through the Q&A or the chat function, but I'm going to go ahead and stop recording. So while you send us your questions, I'd like to thank everyone who joined us today for this event or tuned in to the recording. Thank you as well from home. As you heard this evening, our lovely faculty and guests are always ready to provide such unique insights, whether you're seeking to enhance your existing skill set as a working professional or prepare for a new career in a wide range of healthcare professions. Our MS in health sciences will provide you with those expertise you need to succeed in today's world. So we look forward to receiving applications from those attendees or our currently enrolled students who are here with us today who just wanted to be a part of the conversation. We look forward to seeing you continue in your desired programs. So with that, I will stop recording. Okay.